In preparation, I will gather equipment if it is not already presented at the patient's bedside. I will review the patient's chart for their medical history and previous tolerance to suctioning. When I go into the patient's room, I will introduce myself by saying, "Hello, my name is Alyssa Sichrovsky. I'm a respiratory therapy student at the University of Missouri," and I will inform them and explain the procedure if they aren't already familiar with it. Next, I will wash my hands and put on non-sterile gloves. Then I will assess the patient for indications. Some indications include a sawtooth pattern on the ventilator, a decrease in minute volume, an increase in peak pressure, or if the patient's SpO2 is decreasing. I will also auscultate them to see if I hear rhonchi. I will know to suction then. I will make sure the patient is in a semi-Fowler's position, and I will test the equipment by occluding the connecting tubing and then adjusting the level of the vacuum to between -100 and -150 millimeters of mercury. Now I will monitor the patient's vitals to get a baseline. I will connect the catheter to the suction and unlock the thumb port. Next, I will hyperoxygenate the patient for over 30 seconds. If needed, I will instill 5 to 10 milliliters of natural saline directly into the airway in small amounts during inhalation. I will let the patient know that this procedure will cause them to cough. Now I will advance the catheter without suctioning. Once you hit the carina, you'll hear them cough. You'll move it up a little bit, and then you'll be applying intermittent suction while rotating and removing the catheter completely from the airway in less than 15 seconds. While I'm doing this, I will make sure to keep my eyes on the patient monitor to watch their vital signs. And then I will hyperoxygenate the patient for 1 minute. I will auscultate bilaterally again to see if they need to be suctioned one more time. I will lavage with sodium chloride to clear out the tubing, and I will make sure it's not getting back into the patient. I will lock the suction control and then chart and report to the nurse.